Welcome back to a video on left ventricular hypertrophy. Left ventricular hypertrophy could be of three types. One is concentric left ventricular hypertrophy, that is thickening of the walls of the left ventricle without enlargement of the cavity. That occurs in systemic hypertension when it is severe and long-standing, aortic stenosis, and coarctation of aorta. Eccentric hypertrophy, where the wall is thickened but cavity also gets dilated, can occur in chronic aortic regurgitation because of the volume overload. And a third variety is asymmetric septal hypertrophy. Septum is hypertrophied more than the posterior wall. That occurs in hypertrophic obstructive cardiomyopathy. In some variants of hypertrophic cardiomyopathy, there may not be asymmetric septal hypertrophy. Instead, there can be concentric left ventricular hypertrophy as well. This echo is from a concentric left ventricular hypertrophy. We will not be able to say the cause from this echo image alone. This is the place where you keep the transducer. Free wall of the right ventricle. This is the right ventricular outflow region. Interventricular septum. You may note that the borders are seen much better than the inner part of the septum. That's the usual. When there is a difference in the refractive index, that is between blood here and the septal wall, then the reflections of the echoes are much more. Same thing occurs here. There is an interface between blood which is sonolucent and interventricular septum. In between, there will be less echo density, and speckled pattern can be seen in hypertrophic cardiomyopathy. This is the left ventricular posterior wall. Again, you can see that inner portion is sonolucent because more of reflections occur at the edges. Echo is detection of the reflected ultrasound beam. This is left atrium, a bit dilated, aorta. So this is concentric left ventricular hypertrophy seen from the parasternal long axis view. This is the cross section of descending aorta. This is ascending aorta. This is descending aorta. You can see part of the coronary sinus